morning, everyone. Welcome, and thank you for tuning in to Health Talk. I'm Dr. Victor Kalidi, President and CEO of New Health, the Nassau University Medical Center, over on Hempstead Turnpike in East Meadow. So as the healthcare in America is changing, New Health is part of that change. And so for this half hour, we'll provide you with some essential information about our services and facilities that provide top quality care that fits into your lifestyle. You already know us as Nassau County's premier Level 1 trauma center, but we have so much more to offer the community. We have a full service, state-of-the-art New Health centers of care. We've got the A. Holly Patterson Extended Healthcare Facility. And we have the New Health Family Health Centers located throughout Nassau County as well. So our improvements are making us a leading provider of primary and tertiary care services that rival the best in the country. So Nassau University Medical Center has gone over a lot of changes over the years, from small medical hospital to a large, state-of-the-art, technologically advanced urban university hospital, a training center for many different specialties. We've gone through a lot of construction, built a new $38 million emergency department, second to none in Nassau County. We are the county's only burn center. The hyperbaric chamber upstairs, the multi-place hyperbaric chamber for patients that may have smoke inhalation or diving injuries. A lot of construction, a new orthopedic area, a brand new labor and delivery area. We're also coming up with, just generalized, upgrading of the rooms and flat screen TVs, and really changing the place around. Nassau University Medical Center needs to have a reputation in the community of being the hospital that's there for their hospital. And we provide services in all different areas. One of the services that we provide, and we're very, very proud of, is our Obstetrics and Gynecology. We just recently underwent a major renovation in our labor and delivery room. And if you walk up there and you look at these rooms, you'll think you're in a fine hotel somewhere. These patient rooms are just absolutely stunning. And it's one of these areas where when you come in labor, you're not moved from one area to the next. You go into that labor room, and that's where you are triaged, that's where you have your labor, and that's where you deliver your child, all in that beautiful room. And it's really state-of-the-art equipment. It looks like a beautiful hotel room, and then also the walls spin around. And on those walls are all sorts of the medical monitoring equipment, and then a button and a giant light comes out of the ceiling, and it's like, it looks like an operating room, but then everything goes away and it looks like a really pleasant hotel room. So it's amazing what they did in the labor delivery. We're also a level 3 neonatal unit for very sick children if someone should be born with a lot of medical problems as well. But I've talked enough about it, because what I have here today is one of our fine doctors from the Obstetrics and Gynecology area, Dr. Tetrokalashvili, and she will be talking to us a little bit about what she does. So, Dr. Tetro, why don't you tell us a little bit about yourself and tell us about the program at Nassau University Medical Center?
Sure, thank you. First of all, thank you very much for inviting me.
Oh, I love that.
Thank you. Well, I've been all over the world.
Mm-hmm.
I was born in Republic of Georgia,
Mm-hmm.
and I did my medical school in Moscow, first Moscow State Academy,
Wow.
which is pretty much the Yale of Russia, I would say. And then I came to the United States and went for a year to do the research in NYU. I graduated from the Mount Sinai Queens program, the residency in OBGYN, and then did additional training in infertility at Case Western Reserve University. And for more than 10 years, I'm at Nassau Medical Center, and my heart is here, and I'm very, very proud to be here among very dedicated staff, physicians, residents. It's really an amazing team who, on a daily basis, works hard and takes care of our patients.
We have, great doctors, and I've been here about a year and a half myself now as the CEO, and I had no idea the quality of physicians that are actually working at Nassau University Medical Center. You don't think that. I lived in Belmore, and I raised a family there, and right there was NUMC. But I never knew until I work here now to see the quality of the physicians, the training, the research, the residencies that these physicians like yourself have come from, and it's amazing. And just the compassion and care that you give those patients, and particularly in obstetrics. These pregnant women come in, and then they're so the high risk, and we develop we're able to deliver these children, and really have a great reputation in the community for that.
Absolutely.
So why don't you tell us a little bit about the obstetrics and gynecology in general, and then maybe we'll talk a little bit about infertility and some of the other work that you do.
Sure. I am Chief of GYN Service and Infertility. Infertility is part of the GYN Service. And as I mentioned, because we have such a dedicated staff, it eventually goes down to the patient care. And we've been 4 years in a row recognized by Health Grades as a 5-star service, 5-star GYN service. So I'm very proud of that.
That's an amazing accomplishment.
Yes.
Health Grades, 5 stars for 4 years in a row.
Yes.
I mean, there's no other hospital in Nassau County that received that level of recognition. Is that true?
Oh, absolutely. Yes.
It is
it's
amazing.
the only hospital in Long Island that received
5 stars. People don't realize we have a
Yes.
5-star hospital. We have, Joint Commission comes in to survey the hospital and they give us a 98%. The Leapfrog group comes in, they give us an A for patient safety.
Right.
And when they talk about patient safety, that doesn't mean you get hit by a car in the parking lot. When we talk about patient safety, we talk about IV getting infected, ventilated pneumonias, all those really, benchmarking data, and that we receive an A. Other hospitals don't receive A's. They don't receive 5 stars. And yet here we are, this supposed county hospital, which is, in 1999, separated from the county and has developed into a public benefit corporation called New Health, or Nassau University Medical Center, which is not a county hospital. It's like a state-related private hospital that we're able to run this great physicians and great care.
Absolutely. And as you mentioned, not only GYN but obstetric service. It's a brand new maternity unit. It's really beautiful. It's a pleasure to work there, and patients come and they're really amazed. And the rooms are so comfortable and family friendly. It's very nice for staff, for residents, for everybody to work in that environment, in that renovated unit.
Yeah. And didn't you just open a new water birthing?
Oh,
what,
yes.
What is water birthing?
Water birthing, yes, we have the large group of midwives who brings patients and offers the water births. It's a unique opportunity for patients who want to deliver baby in so-called natural environment, in the water environment. So we are one of the few hospitals, a rare hospital, that actually use that opportunity to go to those patients.
So I just renovated that whole area, I noticed, and the rooms look like something you'd find in one of these honeymoon suites, because they have a big bed, a hospital bed, and they have all those electronic things hidden behind the walls, again, that spin out, and then they have a giant hot tub.
Yes.
Right in the middle of the room. There's this giant hot tub, and women deliver their children in the hot tub, in the underwater.
Yeah.
I mean, the whole. Does the child come out swimming? What happens with that?
Well, we help the child to swim a little bit. We save the child when the child comes. Yes, but child comes in the water, and it's a natural environment, and lungs expand when they are delivered, and the mother has more comfortable births, not so many pain medications that they require. So there are patients who really enjoy that
when we
process.
did the ribbon cutting, we had a lot of women there that had delivered in the water birthing, and they were raving about how comfortable it was, that they didn't need the pain medicine, that it was a lot less painful. I'm sure that it still was a painful.
It's still painful, probably.
Of course. But they were like, we didn't need the medication, and the child was born, and it was so happy, and it was all sorts of good stuff they heard from that. So we have the water birthing, we have our new labor and delivery. What else can we?
We have GYN service, as I mentioned, and we perform all types of GYN surgeries, minimally invasive laparoscopies. And as an infertility physician, we perform infertility surgeries, and actually a lot of centers in Long Island, IVF centers, they do refer patients who need optimizing their fertility. And some patients who have tubal infertility, we do the tubal surgeries. We are the hospital, and it's a very rare service when sometimes patients do the tubal ligation, and years later, because their life changes, or they marry a different partner, and suddenly they want children, and they already had tubal ligation, and now they want another child. Not every patient can afford IVF, in vitro fertilization, so we have a certain population of patients who come and request tubal surgery, reversal of tubal ligation. And we do that laparoscopically, which means just through tiny incisions. It's not a big incision, and they go home the same day. And the positive for reversal of tubal ligation is once the tube is open, and if the risk factors were low to begin with, the success rate is up to 60 to 70%. And they actually try as much as they want, and they can have as many children as they want, versus if they went to in vitro fertilization, they do one trial, and if it didn't work, then they have to go through the whole process again through the IVF. So there are certain patients who prefer to the surgeries.
So you just said a whole bunch of stuff. I mean, really, I mean, for the GYN service,
Right.
for the fact that we have a full service operating room for all sorts of GYN surgeries, where we do minimally invasive surgeries,
Yes.
we do laparoscopic surgeries,
Yes.
where we're able to go in and treat some of the different problems that women might have. And the fact that women that have tubal ligation, in other words, they have their tubes tied so
Right.
they can't get pregnant again,
Right.
that there is in some patients, that qualify for it, the ability for you to take her and minimally invasive or laparoscopically
Right.
open those tubes again so they can become pregnant. So, and that's life changing.
It
I
is.
mean, you're married and whatever happens, and you have your children, you tie your tubes, and then something happens in your life, either you marry or something, and you want another child, and you can do this. So that's amazing. And all the infertility clinics refer here to us for that?
Yes, the IVF centers, if their patient doesn't want to do IVF and they want a reversal, they actually refer patients to us.
Do we do IVF as well?
We do the workup for the IVF, so we prepare the patients for in vitro fertilization. So then they go to the in vitro fertilization center just for the procedure. But in our hospital, we do all the diagnostic workup, all the ultrasounds. We do even the medications, and then we refer just for the procedure to perform the in vitro fertilization. For example, if the patient goes to the IVF center and the uterus, right, is not optimized for IVF, they have polyps or fibroids, our patients come back to us, so we do the surgeries to remove the fibroids, remove the polyps, so they can have successful pregnancy and not encounter miscarriage after becoming pregnant.
Is that one of the big problems with fertility, polyps and the fibroids, and that preventing the egg from implanting inside the uterus?
Infertility, generally speaking, is a big problem, unfortunately, in the United States. 6.7 million reproductive age women unable to conceive, which is about 12% decreased fecundity. What does fecundity mean? It means inability to conceive and inability to have the live birth. Versus infertility is when patients are unable to conceive within an year of trying. It is definitely a disease. Even WHO, World Health Organization, the American Society of Reproductive Medicine, and even Supreme Court, they ruled in on the idea that infertility is not just a life choice or it's not an inconvenience, but it actually is a disease that can cause a lot of stress and anxiety and depression. By the ability to reproduce, to recreate, is a major part of human life.
Sure.
And we as a physicians, of course, it's very important for patients to come to us so we can educate them. There are many causes of infertility, including female and male, but some of them are not preventable, but some of them are. So for us to talk about obesity, smoking, environmental factors, and how to avoid sexually transmitted disease. Those are the preventable causes. So it's very important for patients to seek attention early. When we're talking about infertility and unable to get pregnant within a year, but not everybody should wait a year. For example, somebody who is above age 35, fertility decreases 50% from when they were 20-year-old. So they need to seek attention earlier. It's a disease, it's not just a female disease, it's both female and male. Right? There's a joke, they say, why does it take 50 million sperm to fertilize one egg? And it's probably for a traffic radio show. They won't ask for directions either. Right?
Very good. Yeah. So how many, 50 million sperms?
It's just 20 million is a normal count.
20 million.
Yes.
So 20 million sperms are ejaculated during that type to fertilize the one egg.
One egg, yes.
Wow.
It's amazing.
That's like a race, I think.
Yes.
All 20,000 trying to get to that egg at once.
Yes.
And all you need is one sperm to fertilize that egg?
Yes, it all comes down to just one egg and sperm.
One egg and one sperm.
Yes, and
okay, I'm sorry. So that one egg is then fertilized by that sperm, and it gets half the chromosomes from the man and half from the female.
Yes.
Wow. This is like biology class, I'm trying to remember what the heck goes on in there. That's amazing.
And for patients, it's very important to understand that when they come to the physician, it's important to come as a family. This is a family issue. It's important to bring the spouse, to bring the partner.
Right.
Sometimes infertility is just a window to a bigger problem, to a larger disease. So if we're talking about female, for example, polycystic ovaries, it's not just unable to become pregnant or irregular periods. Patients need to know that they're at high risk of heart disease, they're at high risk of diabetes.
Polycystic ovaries.
Right, they're at high risk of endometrial cancer. So there's all sorts of bigger syndromes and bigger pathologies that we can open when the patients come to us. Same for males. For example, infertility, male infertility has been associated with prostate cancer and with increased mortality in males. So there are some facts and education that we are able to provide and resources to provide to patients to seek early attention.
I mean, you're a physician. You're not just a gynecologist or not just an obstetrician.
Right.
You think of people as a holistic body, and that
Absolutely.
one piece of the anatomy affects another piece, and and it all comes down to well-being and generalized health.
Absolutely.
So you get the mom and the potential mother and father in the room, and you talk to them about it, and you go over different treatment options for infertility and why they're, how long have you been trying, have you been doing it the right way, and all that stuff. And then after that, you do some testing. So you do blood tests and you do sperm count analysis and sonograms and all that stuff.
Yes, we do all the diagnostic tests, including genetic tests. We test the ovarian reserve for patients. We do the sperm test. We do what's called a hysterosalpingogram. This is the test. It's a dye test. It checks the uterus, make sure tubes are open to see if the patient had tubal fertility, right? Fallopian tubes. Sometimes they are blocked. Infertility has many faces. Sometimes you have a young girl who unfortunately started her intercourse early, and she had chlamydia early on, and now she comes to us years later with tubal infertility. So it's not only treating infertility, but also educating and preventing, educating young girls, teenagers on the safe sex practices, using contraception when they're not interested in fertility. So when they don't come to us, but they have ability to procreate.
And unprotected sex for a little bit, and it started decreasing. But now I see an increase again in sexually transmitted diseases, specifically among high school and college students. Lots of gonorrhea, salpingo-oophoridis, chlamydial diseases. A lot of these diseases that we thought may be decreasing because, hey, we grew up in the 80s and the 90s, and HIV was out there, and everybody was afraid that unprotected sex, and it was always in the media, and everybody was concerned about it. But medicine has done such marvelous things with AIDS and HIV today, with the different types of antiretroviral medications and the limiting of the viral load, and the whole thing. How we're really doing a great, really doing great work in that field. But in your field now, in GYN, in obstetrics, you're seeing now patients with scarred fallopian tubes, the effects of having sexually transmitted diseases as a teenager and college students. And these women don't realize that, and these men don't realize that later on they're not going to be able to become pregnant.
Exactly. Unfortunately, yes. As you said, it's surprising, right? You would think that with all the early education in the schools and safe sex practices and condoms and contraception, we should see the decrease in sexually transmitted, but it's actually on the rise. And it's also one of the problems is a public health issue because there is a disparity. And as you know, we take care of the most vulnerable population. For example, African American women, they are at higher risk of sexually transmitted disease, but they're at the lowest rate of seeking fertility treatment. So there is a big disparity, and there is a big cost also associated. And because of that, not everybody, even though they know they have infertility problems, they may come, but only few of those patients fill the prescription and actually undergo the fertility treatment. But the good thing is that at Masso Medical Center we have special programs, we have special grants that make the infertility treatment affordable for patients. So I don't want them to think that it's an infertility and automatically it's an in vitro fertilization and average cost is $12,000 and they say, oh, I cannot afford it, and they never seek attention. Before the patient goes to in vitro fertilization, there are so many things that are affordable and they can be actually done to do the correct diagnosis, to do the prevention, and to treat those patients that I think it's very, very important for them to come early to see the physicians.
Right. And that's something that we have at Nassau University
Yes,
Medicine.
yes,
Yeah,
absolutely.
they don't realize, people should know that, even something, gosh, you get a car accident or some horrible thing, you're going to wind up here.
Right.
But they should come here for their primary care.
Yes.
We have a brand new state-of-the-art primary care center that's supposedly opening this fall. It's about $24 million. It's state-of-the-art primary care, right on the first floor. If you drive down Hempstead Turnpike and you look at at the hospital, the first floor, that whole thing, one half is the emergency room. The other half is going to be all primary care on the first floor. Now, specifically, medicine, pediatrics, and obstetrics and gynecology. So you're going to have a beautiful, brand new facility, state-of-the-art facility where people can just park their car right there,
Yes.
walk right into the primary care center, right to the obstetrics department, and get their sonogram. They could have an appointment with you. They could have an appointment with your doctors, get a complete workup, and it's right there. And they can walk back out, get in their car, and they're on Hempstead Turnpike.
Yes.
They can go to the mall and go shopping.
Oh yes,
Right, it's
absolutely.
right down the block.
We do all types of ultrasounds, saline ultrasounds, the surgeries, hysteroscopies, laparoscopies that can, sometimes you need just a small correction. It's called a subfertility. It's not a big issue, it's a small issue. And you correct the, let's say, fimbrion, the fallopian tubes, or you take the polyp out, and that already increases the chances for patients to pregnant. And we do offer all the services to the patients.
I mean, that's really what we're there for, is for the patients. And no matter what it is, whether it's preventing a pregnancy, for education for a younger person, someone's going to college, and we need to explain to them the dangers of unprotected sex. I'm sure they've gotten that at home, but sometimes when when you're sitting there with a doctor and the doctor tells you something, somehow it sort of it sinks in a little better, because we're saying it for the right reasons. And then, on the other hand, if you want to get pregnant and they're having problems, they could see you and do all the workups. And then completely on the other end, if there's some other problems, you're having dysfunctional uterine bleeding, if you're having some sort of mass or some irregular periods, and you need to see a physician about maybe there's something going on again, maybe there's something we need to know. Cervical cancer, ovarian cancer. I mean, these are killers. And what age should people start screening for that? What age should women start coming to look for these types of issues?
Right now the recommendation is to start at age 21, irregardless of beginning of the sexual activity. Because as you know, the cervical cancer is associated with HPV virus, and it takes sometimes years for HPV virus to cause the changes in the cervix. So it is reasonable to delay the Pap Smear, doing Pap Smear until age 21. But starting from age 21, they should come for regular checkups and to make sure that we do them on
So HPV you mentioned, which again, there's so much to talk about. I have
Right.
guests on the show. A half hour just isn't
Yes, it's
enough
not
to
enough,
talk.
no.
And I hope the listeners are listening to this, because HPV is human papillomavirus.
Right.
And it's a virus that was determined to cause cervical cancer. And they now even have a treatment for that, to prevent
Prevention,
it.
right, with a
that-
vaccine.
with a
Yeah.
vaccine to prevent. So this is one of these diseases that we can actually wipe out, that we can actually stay on top of. And for those patients that didn't get the vaccine, at age 21, they start having changes in their cervix, and you do a Pap Smear,
Right.
which is just a brushing, right? Is that all that is?
Yes.
A
And
brushing of the
it's amazing
cervix.
that you're mentioning it, because even though I'm talking about infertility, we had a patient, she came for infertility treatment. We did a Pap Smear, came up to the cervical cancer in a young patient. And we have all the we have the dysplasia clinic, and we have physicians who actually take care of the cervical cancer. We have oncologists on staff. So it's not just one service, it's all the services that you take, multidisciplinary approach to the patient, starting from nutrition to the cancer and to fertility and so forth.
So Pap smears at 21.
Right.
How about ovarian cancers or uterine cancers? Well, how do we screen for that? Is that just a simple sonogram?
Right. Well, for endometrial cancer is actually on our side, because usually it presents with the bleeding. So the patients come, they say something is not normal. I have irregular periods. Or you have patients who know they are at high risk of endometrial cancer. Even patients with polycystic ovaries. For example, you have a young patient, she's only 25. Usually we would not screen for endometrial cancer in such a young case, in such a young age. But if the patient is obese, and we already know she has metabolic disorders, those are the high-risk population. So we actually offer the endometrial biopsy to screen for endometrial cancer. And it's a very good tool because you pick up the cancer early, you can treat it early. Ovarian cancer is a little bit tricky, and I wish we have the solution for the ovarian cancer because there is no specific screening tool that says, okay, you have it or you don't have it. But there are still some tests that suggest, for example, the CA-125, some tumor markers that we perform that give us some kind of idea in the patients who are at high risk of ovarian cancer. We also do the ultrasounds that pick up the cysts that are suspicious for cancer, and then we can refer them right away for appropriate position for appropriate surgery. We do all kinds of minimal invasive cystectomies, we do the cancer surgeries. So it's a very safe environment for patients to come and be treated and diagnosed and treated.
So when you mentioned metabolic and endocrine problems, I saw Dr. Rosenthal stand up and go, I know about that stuff. So we have that full service there. We have these sonograms. We have all the equipment and technicians to do these types of studies. And we have separate operating rooms. We have our own suite of GYN operating rooms, separate and distinct from the regular surgical operating rooms.
Absolutely.
Which is also amazing.
We operate whole week, every day. We have surgeries, GYN surgeries, starting from oncology and benign GYN surgeries and fertility surgeries. We offer all full scope of services.
And so now the woman has her child, a healthy baby, God bless. We have our nursery, which, most in the hospital when it's really getting stressful, I'll take a walk down to the nursery and just go in there and look at all the little babies, jumping around, which really makes a difference in your day when you go down and take a look at the little babies, And so we have a nursery room, and we also have what I mentioned before, the neonatal intensive care unit. So that's for sicker children. So, a child's born and there's some issues, they're either very small, or they have some problems, medical problems. We put them in that intensive care unit. So we have that contiguous to the OR, and contiguous to the labor and delivery. It's right there as our neonatal unit as well.
Exactly. It's such a pleasure to see a patient who says hello in the hallway with a pregnant uterus, says, do you remember me 2 years ago? You reversed my tubes and now I'm pregnant, and she comes to the labor and delivery and she delivers right there. I think it's the biggest award that the physician can have, to see such a good outcome of what you were able to offer to the patient.
Now we also have our federally qualified health centers out there, and they also are associated with Nassau University Medical Center. So those obstetricians and gynecologists that you see there refer patients back to us here at the hospital. And then we'll be able to treat them and just keep it all together, and all the care, and the same physicians, and it's continuity, and all that stuff. And so it really is a great program that you have there. And there's so much. I mean, we didn't even talk about breasts. We didn't talk about mammography and women's health in general, and the idea that we have the van that goes around, the tomosynthesis. We actually have the mammography van that goes out to the different clinics, and this is a tomosynthesis machine. Most hospitals don't even have tomosynthesis mammography. We have it in a van. The most state-of-the-art. They can pick up very, very small breast lesions with that type of clarity to get early intervention. And we have much better outcomes with that.
And it's important because those physicians, they pick up the phone and say, okay, Dr. Darrow, I have a young girl, she has ovarian cancer, undergoing chemotherapy. What do we do with her fertility preservation? And everything is within my muscle to give the advice and being able to save those patients and help those patients.
Yeah, I mean, because we have a whole women's breast center with, we do different types of imaging for women's breasts, we do mammography, and basically, if there is a cancer, we have the surgeons that can handle that. And we even have some breast reconstructive surgeons from the Long Island Plastic Surgical Group that work with us, and they do amazing work. Some of the doctors there from LIPS that really are able to take care of our patients. There's so much going on in all these different fields of medicine. So, I mean, you've been a great guest, and there's just so much more we could talk about. I want to talk about the residencies. I want to talk about primary preventions and things like that. Maybe we'll have to bring you back and talk about that again, all right? If you have the time for us.
Absolutely.
And I just want to say to everyone, I hope you enjoyed this morning's talk. It really was. I thought it was really interesting and really touched on a lot of different things involving women's health and men's infertility. This is Dr. Victor Politi. I'm the President and CEO of Nassau University Medical Center on Hempstead Turnpike. You know what? I didn't ask, what is the phone number? If someone wanted to come to talk to you,
sure,
or make an appointment with you, how do they do that?
Sure. The phone number to call 516-572-6255.
6255.
And they'll find us.
Right. So 572-6255.
It's in an OB/GYN office.
And that's a human, a regular person, not a machine or anything?
No. There's always a person who answers the phone.
And hi, this is Vic Politi. I'd like to make an appointment to a gynecologist, and she'll just take all the information for me.
And then she will refer you and direct you
to where I go.
Right.
That's such a pain. You try to make an appointment. Yesterday I had to go to the dermatologist, so I call up and I said I have a thing that all of a sudden on the side of my head I like have checked out. You know what she told me? 6 weeks. I said, Dr. Politi, 6 weeks? I said, are you kidding me? I said, I'll be dead in 6 weeks. She goes, no, it's all my collection appointment 6 weeks. I said, all right, thank you. But that wasn't our hospital. That was different. So then I was in the elevator and I'm running into Dr. Lou Rena from Lips. And I go, Lou, what's going on with my head? So he looks at it and goes, that's nothing. It looks like a little something, whatever. He goes, let's just take it out. So, I mean, the point being that it's so hard to get appointments. But with Nassau University Medical Center, you call a number, you speak to a real person, and you say, hi, I'm Vic Politi, I need an appointment, and they'll give you the next appointment. So it's great. Anyway, I'm speaking too late. I'm going over my time. Again, I forget I'm on a radio show. I'm just talking to another doctor.
Nice conversation.
I just forget I'm talking to another doctor in the hallway. Anyway, thank you all for listening. It's a beautiful day out there. I want you guys to get out there and be healthy and get some exercise. And again, we're Nassau University Medical Center. If anything, we're here for you no matter what. So enjoy your day and thank you.
Thank you very much.
And thank you, doctor.
Thank you.